All right, ladies and gentlemen, we are live. Thanks for stopping by if you are here. The purpose of this quick live, I should say, is to try to just help provide some insurance information with open enrollment coming up. I deal with questions all the time, and there's some people that I know I don't get a chance to speak to. So I said, let me just jump on, give a quick bit of information, some things that will be helpful come open enrollment so that you guys will be prepared. And if there's questions, I'm more than happy to help and assist any way that I can. So if this is the first time that you're running into me, thanks for stopping by again. My name is Jeff, and I am a licensed agent. I work with folks all over the country with trying to find insurance. So like I said earlier, I get questions. Today in this video, I just wrote down a few things I want to talk about. I'm not going to be long, but if you want more information about specific things that I do not talk about in this video, feel free to ask questions in the chat, and I'll get back to you. If not, keep watching, because I'm pretty sure I'll be doing more of these videos just to be able to give information and help anybody that might be looking for answers to questions. And rather than asking people that may not be licensed and know what they're talking about, feel free to drop them in the chat, and I'll be happy to jump on and help and assist. With that said, I want to jump into dates and deadlines, open enrollment. So I mentioned that earlier. That's coming up. For those of us that are new to shopping for insurance that might have been on an employer-sponsored plan, your employer usually has their own open enrollment dates and deadlines for you to sign up for their coverage. But for the rest of the people who are individuals or people with families like myself, I have a wife and 2 kids. So if you're in the same situation with the family, you may not be offered health insurance through your job. In that case, the marketplace, which is basically healthcare.gov, if you're in a state that does not have its own state exchange. If you're in a state like California, Covered California is our state exchange. So any application for health insurance goes through Covered California and then to the carrier, whether it's Kaiser, Blue Cross Blue Shield, or Blue Shield of California, United Healthcare, whoever it is. Right. So that's just the process. Now, you can get insurance from a variety of different places. You can go directly to the insurance company, and that's usually what we call off exchange. You can go through the marketplace. Like I said, the state exchange, healthcare.gov, anything like that you'll be able to get your health insurance through there. You can also go through a web broker. I'm currently working with a company called Stride. Stride is a web broker. You can go through Stride to shop for the plan, sign up for the plan. They become your broker, and they take care of submitting that application so that way you can get coverage. So there's another way. You can get an independent agent, right? Somebody who's licensed and can, transact insurance and take care of you. That could be another way that you get insurance for yourself or for your family. So those are pretty much all the ways that you can get insurance when open enrollment comes around. And as we said, open enrollment, November 1st is when open enrollment begins. So that's when you're able to start signing up for a plan. That plan will actually start and take effect January 1st of 2025. Even though you're signing up in November, it's not going to be active until January 1st of 2025. So keep that in mind. And November 1st through January 15th is the first window of you to be able to turn in that application. If you miss that window, you can still turn in your application from December 16th through January 15th. The only difference is rather than a January 1st start date, you're going to have a February 1st start date in that case. So if you want a January 1st start date, then I recommend keep an eye out and don't miss that opportunity when it comes up. It'll be November 1st again through December 15th. First window, second window, December 16th through January 15th. Now, sometimes people ask, how do you qualify for the subsidies? Everybody qualifies for different amounts of subsidies, if at all they qualify for the subsidy. So it depends on the information that you put into the system. If you put in that you're a single individual in a certain zip code and your income is a certain level, then you may or may not qualify for tax credits, just depending on the situation. And each situation is different. I recommend putting in your information and seeing exactly what tax credits, if any, that you qualify for. Keep in mind, the IRS is involved. So a lot of times I get questions about, well, what happens if my income estimate isn't matching at the end of the year? Since you are required to basically guess what you're going to make for 2025 before 2025 even gets here, you have to be aware of what you're putting down in that section, because it does impact the amount of financial assistance that you could get. So your income as a household is what they're looking at before taxes. If you're an independent contractor, somebody maybe that has a business, if you're working with Uber, Lyft, DoorDash, any of your personal deductions or your business deductions, you're allowed to remove that from your income. Your adjusted gross, your modified adjusted gross income is what they're looking for. Take off any expenses for business or personal. That number is what they're going to see on your taxes. So that's what they want you to put down on that application. And with that, they'll determine your level of financial assistance. Hope that makes sense. But again, ask questions. I'm here to help. Sometimes, people ask about, metal tiers, things like the bronze, the silver, the gold, the platinum. What does that mean? Different carriers will offer different metal tiers, and that simply is the amount that you and the insurance company are basically going to be splitting once they start covering costs. So you'll usually see things like a deductible and then after deductible pricing. So if it's a bronze plan, for example, they're usually going to cover at 60% and you're paying usually 40%. If it's a silver plan, usually they're covering at 60 or 70%, excuse me, once you've met your deductible, and then you're responsible for the other 30. Gold plans usually 80 and you're responsible for 20. And if you have a platinum plan available, it'll usually be a 90-10. So as you can see, the higher the metal tier, the more coverage you get, but also the more you have to pay out of pocket monthly for that. So that's a little bit of, what the metal tiers mean. When it comes to network types, sometimes PPOs, EPOs, HMOs, POSs, all these different things can be, confusing to understand for some people. But essentially, it's just letting you know the type of network. Just simply states, do you have to have a primary care physician give you a referral before you can see a specialist, or can you just go? Is there a wider range of hospitals, facilities, and doctors that I can access with this particular plan? So within the different network types, you'll find different things that are either more restrictive or give you a little bit more freedom. And you tend to find the more restrictive plans, HMOs, the more plans that give you freedom would be the PPOs. But of course, most of the PPOs cost more. So if you don't want to spend more, you might not be looking at a PPO. But if you want that freedom to choose, you might want to consider a PPO as well. So without giving you guys too much information here, we're going on 10 minutes, and I said I didn't want to keep this long. I hope that's enough to kind of get you thinking in the right direction about how insurance works and when to start looking to sign up if you haven't already. I can't tell you how many times I get questions about, why can't I sign up for insurance at any time? It doesn't work that way. So there's open enrollment coming up, and I don't want anyone to miss it if they want the coverage. So that's why I'm doing these videos, and I'll keep doing these videos so that way I could just share different pieces of information, different insights, so that way anybody, again, that's looking can have access. And if you're watching this and it's beneficial to you, feel free to share it. Somebody else that may be able to use and benefit from the information here. So I'd encourage you to do that, and I'd appreciate that too. So the last thing I'll talk about is, avoiding costly mistakes. The fact that I talk to so many people about insurance, I say this all the time, people buy insurance because everybody else around them has insurance, and sometimes they tell them that they need it. So, hey, I don't want to be the odd man out that doesn't have insurance. So, a lot of times when I talk to people about health insurance specifically, right, things like your deductible, out of pocket max, co-pays, sometimes even the carrier, people don't know who their carrier is. That lets me know that you're just paying for insurance to say that you have it. Sometimes people call in and say, hey, look, I know I have insurance I signed up for, but I don't even know who the carrier is. Can you send me my ID card? We're not the insurance company, so we can't send you your ID card. You have to reach out to the carrier. So things like that sometimes let me know that people buying insurance sometimes have no clue what they're buying. They're just buying it. So I want to let you guys know that there are so many different things that you can learn about insurance. It doesn't have to be crazy, but if you understand, first of all, who your carrier is, you understand what the deductible is on the plan that you're buying, you understand what the out of pocket max is, you understand how the after deductible pricing is going to affect you, and all the other things that are just, basic. If you understand those things, you'll be further along than so many other people that are paying for insurance right now. So I encourage you guys to just start with baby steps. Don't get overwhelmed. And again, if there's questions, I'm here to help. Feel free to just leave them in the chat, and I'll be here to answer those questions and hopefully provide clarity. With that, ladies and gentlemen, you guys have an awesome day. It's been about 11 minutes, and like I said, I didn't want to keep it too long. I wanted to give you bits and pieces, but if this information was helpful and beneficial to you, feel free to subscribe, share, comment, again, so we can engage in dialogue and make it a discussion. I want to see you guys on the next one. Until then, stay safe, and we will talk soon. Peace.